Tom Coburn and I disagree. But there are two big things that we agree on that bring us here together this morning. The first is that we both love our country, and we can see it heading over a fiscal cliff unless people like Tom Coburn and me come together to get our government's books back in balance. The second thing is we both love our children and grandchildren, and we don't want to leave our country to them in such an economic mess that they won't have the same opportunities we had growing up in America. That's why Tom and I are making this proposal that will cut our national debt and preserve Medicare as a government program for current and future seniors. There's not much disagreement about the basic facts of America's current fiscal crisis. Our national debt is over $14 trillion and growing by more than $1 trillion every year. The biggest, but not the only drivers of the debt are entitlements, including Medicare. So if we don't deal with those entitlements, we're never going to balance our budget again. Almost 50 million Americans depend on Medicare now, and about 20 million more people will go on Medicare during the next 10 years, mostly because of retiring baby boomers. Each Medicare beneficiary, each Medicare enrollee, will, on the average, take almost 3 times more out in Medicare benefits than they contribute in payroll taxes and premiums. The number varies based on income and family structure, but that's basically what it is. About 3 times more out than you put in. That's why we say that the status quo in Medicare is unsustainable. And what we mean is that if we do nothing, Medicare will go broke and take our government down with it. Medicare Part A, which is for hospital insurance, will be bankrupt by no later than 2024, according to the Congressional Budget Office, and as soon as 2016, 5 years from now, according to some experts. Parts B and D for doctor's services and prescription drugs will continue to drain increasingly large and unsustainable amounts from our federal treasury, adding to our already enormous debt. These facts lead Tom and me to 2 painful but unavoidable conclusions. The first is we can't balance our budget without dealing with mandatory spending programs like Medicare. The second is we can't save Medicare as we know it. We can only save Medicare if we change it. And that's what the Medicare reform plan that Senator Coburn and I are proposing today will do. It will save over $600 billion in Medicare costs over the next decade, extend the solvency of Medicare for America's seniors by about 30 years, maybe more, and reduce Medicare's 75-year unfunded liability by about $10 trillion. Our plan contains some strong medicine, but that's what it will take to keep Medicare alive. We believe our plan administers the medicine in a fair way. It asks just about everyone to give something to help preserve Medicare, but it asks wealthier Americans to give more than those who have less. And our plan, for the first time in Medicare history, will offer to protect seniors from paying more than $7,500 out of their pockets for health care in any one year because of a serious medical crisis or long-term illness. Here are some other details in brief of what we propose. We're going to require higher income Americans to pay more for their share of Medicare Part A, B, and D. For Parts B and D, we will ask wealthier Americans to pay 100% of premium cost. We simply do not believe that tax dollars should be used to pay premiums for those who can afford to pay on their own. We will replace Medicare's current complicated cost-sharing requirements with a unified deductible of $550 and limit Medigap coverage of Medicare's cost-sharing to encourage wiser use of health care services. We will increase the eligibility age for Medicare over a 12-year period from 65 to 67 to reflect real-life gains in life expectancy, which has increased since 1965 when Medicare began from less than 70 to just about 78 years now. And we will make clear that as the eligibility age for Medicare increases 2 months each year, so too will the access to the exchanges created under the Affordable Care Act. We will increase the premium to 35% of the program's cost for Part B for doctor services and D for prescription drugs for enrollees. Premiums from beneficiaries now cover only 25% of the costs of Parts B and D. The rest is paid by the taxpayers. Even though when President Johnson signed Medicare into law in 1965, he made clear that the intention was that the government would pay half the cost and beneficiaries would pay the other half. We will provide a 3-year paid-for SGR or doc fix designed to bring stability to the Medicare provider system. The SGR is in need of a permanent fix, and the 3 years should provide Congress with enough time to come up with one. And we're going to include the FAST Act, introduced by Senator Coburn and Senator Carper and others, to root out the waste and fraud in Medicare. We know that each part of our proposal will make some group of people unhappy and will provide easy target for attack by those who understandably want to preserve the status quo. But the status quo only leads to the collapse of Medicare and fiscal disaster for our country. We're way past the point when we can save Medicare and cut the debt while keeping all the interest groups satisfied and all of our constituents happy. If there ever was a time in American history for elected officials to stop thinking about the next election and start thinking about the next generation, it is now. I'm really pleased to have worked with Tom Coburn on this. He's got a long-time record of thinking about the next generation and not the next election. He's built up tremendous expertise in the area of government financing. If you ask how did we come together, after I voted against the Ryan plan when it came for a vote in the Senate, I said to myself, okay, I've done that, but the alternative now is not to do nothing, because if I do nothing more, Medicare is going to go bankrupt. So I set out to try to figure out how we could change Medicare to basically preserve it as a government system. I wrote an op-ed in the Washington Post. Tom read it, called me up, and he said, I appreciate what you're doing, and I want to see if we can work together on something. And I'm really proud that we did work together. We came up with this program, which I hope, and I believe Tom does too, creates a bipartisan beachhead, if you will, around which perhaps the gridlock and the breakdown and the discussions about dealing with the debt ceiling and our debt overall can occur. Senator Coburn.
Well, let me say what a pleasure it's been to work with Joe on this. You know, the time to put a smoke alarm in your house is not when the fire's raging. It's to put it in before the first vestiges of an inferno would start. And the real question that we have out in front of us that people aren't coming to grips with is, it doesn't matter what politician's standing up here or who's the administration, 5 years from now, Medicare won't be the same, because we can't borrow enough money to keep it the same. We won't have the capability of doing that. So the time to fix Medicare is now, and the time to put it on a footing that will truly, you know, save $10 trillion, markedly reduce the unfunded liabilities for it, and markedly increase its life expectancy. So I won't go into the details of what we've outlined. Joe has done that. But I believe what we have to do is act. And if the longer we wait to act, the more painful it's going to be for the very people that are most dependent on these programs. And rather than to come down to a time in which we actually make drastic cuts in the available care for American citizens, The time now is to preserve that and do it in a way that will cause a better utilization with the same or better outcomes and guaranteeing that they have access to the health care that they were promised. We'll take your questions, Chris.
Senators, you talked about wanting all Americans to share the pain in your plan, but I noticed that you didn't ask the pharmaceutical companies to share any of the pain by requiring that Medicare Part D be able to negotiate for drug prices. Why not?
Well, we didn't ever have that discussion. It didn't come up. That's a contentious issue. There are a lot of people think that the government can buy it cheaper than what it's been supplied so far. I'm not sure I believe that. The question, it actually goes to a broader question. Right now, we're losing half of our medical device industry in this country. We're going to lose a large portion of our pharmaceutical industry. To say that they can't have a profit when they're competing for Medicare goods. Under Part D, what happened, it's one of the rare instances where CBO estimated something and got it totally wrong, right? They got it totally wrong of what the cost of the program is going to be, even though nobody contributed to the $12 trillion unfunded liability for Part D. The fact is what we want to do is we want to move in a bipartisan way. Is that an issue that markedly divides Democrats and Republicans? Yes. Why would we add something that doesn't give that much saving? I know what the projections are, but there's no foundation to those projections. My belief is, that doesn't mean I'm right, it's just my belief. Why would we add that to make it harder to get a bipartisan solution for Medicare?
Yeah, look,